I'm just not having the greatest day. I mean, I got this old Toyota, broke on me, so I had to bike all the way to Salisbury and almost got to Salisbury. And the fork broke, so I had to walk the rest of the way and carry my bike. I'm just not having a good day. Well, let's at least look in the ER, see if anything's going on. Oh, seems there's a hematuria consult down there. Let's give them a call. This is Kyle Wood with Urology. Hey, bud. Hey, bud, I hear there's a hematuria consult down there you need our help with. Who's the patient? So you need a catheter put in? Okay. Let me call KC and we'll go from there. Okay.
Kyle. What's going on, Kyle? What did Rob and AJ say to do, Kyle? Kyle, I'm in an important research meeting right now and I cannot help right now. Kyle. You hear, Kyle? Kyle, is the patient making good urine here? Kyle. Kyle, how much is bleeding? Kyle, you cannot assume the clot is all blood, Kyle. 1/3 is urine, 1/3 is insensible losses, and about 1/3 is unaccounted for, Kyle. So he's probably not bleeding, Kyle. You understand? Kyle, I'm not just so sure that we can handle these big cases here. Kyle. Kyle, what do you think, Kyle? Well, where is Ashok, Kyle? Kyle, I need his help. Can you call him? Kyle, send him to Baptist Hospital, and because we cannot deal these big cases here, and let Ashok to know.
I really wish Zach would finish my kitchen. So I used to have to eat salad and microwave pizzas. Who is this calling? It's the ER. Hello, this is Brandy with Urology. You paid. So you got someone with hematuria. Have you guys gotten labs? Has someone even seen the patient? Have you even run this by your attending yet? Okay, fine. I guess we'll come see it. Bye. David. David, we have a consult in the ER.
Okay.
It's for hematuria. It came from the VA. David. Come on, David.
Oh, yeah.
Who's on call today, David?
Davis.
Fine, let's go talk to Davis.
Okay, who is the patient? What's wrong with him? Hematuria? What's the name again? Oh, yeah, I remember him. You know who he is, don't you? He's a very prominent patient I've taken care of for years. I took care of him back in Greensboro when I did a seed implant on him for prostate cancer. You know, I've brought 35,000 patients with me when I came over from Greensboro. I knew him back at Swanee, back when we went to school together and we used to go out and bird hunt. And his daddy and my daddy used to golf together back when they were trial attorneys back in Monroe. So we need to take really good care of him. You know, he's just smart as a whip and very, very successful. Now, I need you boys to really bird dog this thing. I just can't figure out why he's got hematuria after a seed implant. That just doesn't happen. It must have been some bad dosimetry. Well, if he ends up needing to go to the OR and needs a cystectomy, I want to make sure you don't forget that RDAOD stitch, the Rookie Davis angle of death stitch. It's very well known at Baylor. You know, they still talking about it, the Ben Taub. Wait? You need me to come in and see him? I'm all the way in Greensboro. It'll take me too long to get there. Just call one of my other partners and I'm sure they'll be happy to take care of it for me. Just keep me informed. Thanks.
David. David, who else can we go talk to? I think Rick Dallas is in his office. Let's go, David. Dr. Rick Dallas.
Brandy, I'm Dan Ruxtalis, but you can call me Dan. Right. I'm debating between the toxicity of doing nothing versus doing something. I'm compelled by the fact that I am the best at what I do. Why don't we make this into a QI project for you? And I'll arrange a competency conference for you all to write an essay about the toxicity of doing nothing.
You should call Evans.
Evans? Yeah. You got what? Hematuria? Is this my patient? Because they'd call my cell phone directly. I see. Man, sounds like she was in retention. Yeah. She's probably bleeding just from the distension. Yep, she's got it. Listen to me. She can see me as an outpatient. Okay, I still practice some medicine, but mostly all I do is make boxes green.
David, I don't think it's going to work like that.
Dr. Terlecki. Dr. Terlecki?
Dr. Kozlov, how you doing, bro? Oh, you got a consult. Hematuria? I mean, you know I'm not the cancer guy, right? All right, well, is he on B12? How about the bladder void? Did you start him on the bladder void? Well, what's his BMI? Because, you know, I was thinking about really getting back into shape here. Did I ever tell you about when I used to be able to run a 5-minute mile? Oh, yeah, that was when I was dating Shannon Doherty. It's okay, I was dating a Colts cheerleader at the time, too, so it all worked out. All right, well, is he cash pay? Because, you know, I got to pay for that hot tub and that swimming pool I got in the back. Those don't come cheap. I mean, it was a little cheaper back when I was at the D. You know, did I ever tell you that story about that Skid Row concert that I was almost at and almost got arrested at? No? No, I didn't tell you? All right, well, anyway, we're probably going to have to take this guy to the OR for an emergent urethroplasty. So why don't you make sure we got a headlight? Because we really got to concentrate on illumination, magnification, and lubrication, right? Okay, just tell him we're not afraid to take buckle, bro. Okay, well, anyway, if he doesn't know me, just Google me, okay? All right, Dr. Kozlov, I'll talk to you later, okay? All right, bye-bye.
I'm getting tired of ramen noodles. And
What?
only having a microwave, David.
Let's call Hamill.
Okay, let's call him.
Dr. Hamill, we would like to run a hematuria consult by you.
Okay. Do one thing. Okay, we can write this up. We'll call this prospective non-randomized analysis of the first-year urology resident placement of urethral catheter. We can send it to JAMA to get their reviews, and then when it's rejected, we can send it to the Northeast Siberian Urologic and Dermatologic Journal. I have a friend who works here. Where is Manish? He can make the video.
Well, Dr. Hamill, I think we need to figure out why this patient's bleeding right now.
Okay, David, let me make a recommendation. No. When you measure the distance to the bleeding, it'll be exactly 28 centimeters.
Well, then, what next?
Has he had a bowel movement? Give some fleets and Lasix. What do you think?
You know, Dr. Hamill, I'm not 100% sure. We might go seek someone else's input here.
Okay, cool.
You think we should call Majid? David, come back to me, David.
Majid.
Hello? To push me? What's up? Yeah, for sure. What you need to do is about, look, probably TB, yeah, TB. Really, I'm saying, 100%. Okay.
Is Gutierrez back in the country?
I don't know. We should call him.
Dr. Gutierrez, we need someone to discuss a hematuria consult with.
Yes, my friend, tell me. Yes, when you see hematuria, you must listen to her. You must sniff the catheter and see how she feels. When I treat hematuria, she's like a beautiful woman to me. You must make sure she understands this.
Well, Dr. Gutierrez, do you think you can come down to the emergency room and come see the patient with us?
Yes, I am in the PACU. Where is the patient?
Sir, I don't think you're in the PACU. I'm in the PACU. The patient is in the emergency room.
What is the PACU? Where am I right now?
It's okay, Dr. Gutierrez. We'll find someone else. David, what's going on, buddy? Chaz, we have a hematuria consult down in the emergency room. Wait, he's got hematuria? Hold on. Does he have a catheter in? Who put it in? Where'd the catheter come from? What size is it? Oh, man. He just needs a Valium. Let's see what Ilya thinks about this. Hey, boss. It sounds to me like we gotta call medicine on this one. And don't take their first offer. You gotta negotiate with them. When they try and tell you something, no, you gotta go back and you gotta ask and ask and ask again. No, you cannot take the first offer. They are trying to pull something over on you in here. Look, do you want me to do the negotiating with them? I can do the negotiating with them. But listen, no matter what they say, they need to stay in house for at least 2 weeks. Bare minimum, 2 weeks. I just don't feel comfortable of them leaving the hospital in less than 2 weeks. What if something goes wrong? All right, fine, call somebody else. He's got hematuria, but I don't know what to do.
Jessica, I have a hematuria consult. I need some help.
Brandy, I don't think that we really have time for this. I have to be at the gym in 11 minutes. After 26 minutes at the gym, working out with my Division I athletes, I'm off to make my dinner. That'll take me 14 minutes, and then I plan to clean my house for an additional 1 hour and 6 minutes following that.
Okay. Can you give me any advice?
Really, from my vantage point, I just don't think that this is a very big problem.
Okay, thank you. I'll go ask someone else.
I spoke to Rosales. I still don't know what to do, Marla. What are we gonna do?
Hey, buddy. What's going on? You got a consult for me?
Hey, Tristan, we got this guy in the ED. He's got some hematuria and...
Oh, wait. He's got hematuria. But what about his other medical issues? What about his diabetes? Does he have diabetes? What is his A1C? Those are important. What meds is he on? We need to optimize those diabetes meds. Is he on any blood pressure meds? I'm sure he's on a slew of them. But you know what's really important is that we optimize those medications. I don't care that he came in for hematuria. That will eventually resolve on its own.
Oh, man, I just needed a minute.
Hey man, you're looking good, looking buff.
I don't know, bud. I think Haley's done a pretty good job with you. All those sprouts and kale, it seems to be working.
See, I can't lie to you, man. I can't stand that stuff anymore. All those black bean burgers, all that kale, all those sprouts. I really just need some fried chicken and some bacon. I think she's on me. I'm letting myself go. All this bacon, all this fried chicken I've been pounding. What do you think? Do you think she's on to me?
Man, that's a pretty sweet unicorn tattoo.
Isn't it? I just got it last weekend. You think Haley will like it if I show it to her?
That's a lot of man pretty going on right there.
Yes,
Yep.
a lot of man pretty.
Yep, a lot of man pretty.
David, got to pee. Hurry up.
Do you think we can call Bud Lonnie?
Yes, David.
Hey, Dr. Bedlani,
What's the question? Seriously, hurry up. I don't want to monologue. I want 1-2 sentences. No, speak up.
But Dr. Bedlani, he's complaining of...
What does that mean, he's complaining of? I'm trying to ask you a question here, and you're giving me an answer to another question?
But Dr. Bedlani.
Do you know how important I am? I signed my own AUA Lifetime Membership Award plaque. That's how important I am. Just be careful.
But Dr. Bedlani.
I hate to do this, but I have a conference call in 3 minutes, and then I need to catch a flight. Then I'm back in 9 days. We can talk.
Maybe Hodges could help.
Hello? Hello? Hey. Hey, before I start, I just wanted you to know, I'm number 1 in the number of OR cases. Cool. Cool. Wait. You have an adult patient you need help with? Hey, I just got a new phone and a new watch. This is awesome. The new watch, I mean. Cool. Cool. How does Apple keep coming up with this stuff? Have you seen Taylor Swift's new video? What was it you called about? Really? Oh, I don't know. Let me look it up in Campbell's. Hold on. I can't find it. There are too many words. I don't have the attention span to read this. Is the patient constipated? No? Can I shock it? No? Well, you better get somebody else.
You think Dr. Atala would have any insight into this? David.
He's the chairman.
Yes, Barack. Yes, how's your family? Excellent. Yes, I did enjoy the visit last week, but next time you must come to Winston. We could go to Old Salem. Yes, thank you. Can you hold, please, Barack? One of my nurses is calling me. Yes, Brandy. Brandy? We don't have a resident named Brandy. Oh, yes, now I remember. How could this have happened? So Brittany, Brandy, Brittany? How was your family? How was your newborn? Yes, your 3-year-old, of course. Yes, thank you. Yes, no, Brittany, I have to fly to Singapore tonight, and I will be returning tonight, and then fly to Hong Kong tomorrow, and come back tomorrow night. So I do not do adults. Have my partner do it. One of my partners. Thank you, Brittany. Thank you.
Hello, this is Brandy with Urology. Can I talk to the ER attending, please? I've talked it over with all my attendings, and we cannot reach a consensus. I would recommend having the patient go to Forsyth and just ask for Brandon Craven. Thank you.